This month is Autism Awareness Month. As communities become more aware of people with autism spectrum disorder, we are seeing changes in how we diagnose, treat, and understand children with this condition. And for more on that, we are joined by Dr. Koren Boggs from Children's Hospital. Dr. Boggs, good morning to you. What are the main characteristics of autism?
Good morning. Thank you for having me. The main characteristics of autism have to do with differences in social interaction and understanding, and maybe unusual interests, restricted interests, repetitive behaviors, some sensory differences, and maybe trouble with language and communication overall.
Are there early signs, or when would a parent of a very young, toddler or young preschooler notice this?
Right. There are definitely some signs that can be present even before 2 years of age. So some of the things to look for would be maybe not responding to their name when they're called. So some parents might think their child can't hear because they're not responding to their name, but they respond when the television turns on or when a door closes. Some children with autism, some of the early signs might be not waving or pointing, not making eye contact, maybe being interested in things that spin or move, like ceiling fans or wheels on toys, instead of playing with them as intended. Some of those things can show up pretty young.
And I know, doctors such as yourself know a lot more about this condition than we did 40 years ago. Beyond childhood, when you get into adolescence, what happens then?
So it sort of depends. Autism, as we understand it, can be lifelong. It can change over time in terms of how much autism affects somebody's life or functioning. For some folks, as they approach young adulthood and adolescence, they may experience more social differences or difficulties, or may have anxiety or depression, or begin to experience some other kind of behavioral health or mental health challenges associated with some of their difficulties.
And I want to make sure we get to this and have time for this. So let me ask you this question. In terms of diagnosis or treatment, what's involved in getting this diagnosed?
So autism is technically a behavioral diagnosis. So there's not a medical test for autism. It's a collection of symptoms that probably represent a lot of different things, but we sort of look for an exact pattern of symptoms. We look at how kids communicate and play. We do behavioral observations, parent interviews, some assessments. There can be associated medical conditions, but there's not a specific medical test for autism.
And I gather too that the conditions can be different too. It's not like somebody has this same set of 6 characteristics or something like that. It might just be somebody who seems overly shy.
Possibly. So autism affects people differently across the spectrum. It is a much bigger spectrum than we used to understand. It was pretty narrow before. So some people with autism have advanced conversational skills, but have difficulty relating to others or understanding relationships and social rules. They might have really specific and intense interests, but are able to kind of care for themselves on a daily basis.
And then, unfortunately, I'm out of time, but are the outcomes better than they used to be, 30, 40 years ago?
Absolutely, absolutely. We know a lot more about the importance of early intervention. Kids have access to more effective early intervention, and I can't stress enough the importance of early diagnosis.
Gotcha. All right. Dr. Koren Boggs with Children's Hospital, thanks so much for your insight today.
Thank you very much for having me.